Hi, I'm Shania, and I did my informative speech over mental illnesses in mothers. When you look up the definition of mental illnesses, there's not a very specific definition due to the various amount of mental illnesses. However, according to the American Psychiatric Association, there's a term that shows similarity, and this is the health conditions involving changes in emotions, thinking, or behaviors, or a combination of these. Mental disorders are more common now in the 21st century. About 19% of Americans will experience some kind of mental illness throughout their lifetime. 4.1 will experience a serious mental illness, and 8.5 has a diagnosable substance use disorder. Mental illnesses can range anywhere from anxiety to depression, and anxiety and depression can come in any form, especially in new mothers, and this is called postpartum depression. Not only do mothers go through postpartum depression, they also go through postpartum psychosis. There are many ways to spot the signs and symptoms of postpartum depression and postpartum psychosis and how you can help a mother who is going through these mental illnesses. Postpartum depression usually occurs after a woman has given birth. This is also known as the baby blues. The baby blues usually happens to first-time mothers, and it can happen anywhere from a few days to a few weeks after the baby is born. On the brighter side, not all mothers go through this. According to the Women's Health Illinois Department of Public Health, about 10 to 20% of new mothers will experience a more severe form of depression, and this is also called postpartum or perinatal depression. A lot of new mothers who experience this depression may sometimes want help to guide them as a new mom. However, there are some who may not. There are signs and symptoms to see that a woman is going through postpartum depression, and the signs that the American Women's Health Illinois Department of Public Health describe this as restlessness, anger, sadness, worthlessness or guilt, fear of hurting herself or her baby, overly concerned or little at all, little to no energy, trouble sleeping, not eating well, trouble focusing, and little interest in the things that she may have enjoyed. Anyone can spot the signs and symptoms that a mother is going through postpartum depression. However, postpartum psychosis may be a little bit harder to spot. Postpartum psychosis is also similar to postpartum depression. On the other hand, postpartum psychosis is when a person loses touch with reality. Postpartum psychosis lasts also longer than postpartum depression. There are signs and symptoms that a person may be going through postpartum psychosis, and that is hearing or seeing things that are not true, going through changing moods from extreme sadness to very energetic, suicidal thoughts, and violent thoughts such as hurting herself or her baby. There is a woman by the name Andrea Yates who has went through postpartum depression, postpartum psychosis, and schizophrenia. She had 5 children. Her doctor tried to inform her that the more children that she had, the worse her mental illnesses were going to be. However, she did not listen. On June 20th, 2001, her mental illnesses took over her, and she proceeded to drown all of her children. She said that her children were doomed to damnation, and the only way to keep them from going to damnation was to kill them. As you can see, postpartum depression and postpartum psychosis is a real thing. However, they can be helped and treated. Postpartum depression can be treated within time. You can also see a psychiatrist. Postpartum psychosis can also be treated too. Postpartum psychosis will be harder to get over because it's just something that you cannot get away from. It's hard. It is. And as you can see, mothers are some of the strongest heroes that we can ever think of. Postpartum depression and postpartum psychosis is a very real thing that we need to take more attention to. Thank you for your time.